Lies supine while the examiner stands next to the subject. With arms crossed, places the heel of both hands on the subject's ASIS. The examiner will apply an outward and downward pressure with the heel of the hands. A positive finding is unilateral pain at the sacroiliac joint in the gluteal or leg region, indicates anterior sacroiliac ligament sprain. Hoover test. The subject relaxes in a supine position on the table while the examiner places both of the subject's heels into the palm of the examiner's hands. The subject is asked to perform a unilateral straight leg raise. The inability to lift the leg may reflect a neuromuscular weakness. A positive finding is also noted when the examiner does not feel increased pressure in the palm that underlies the resting leg. Bilateral straight leg raise test. The subject lies supine with both hips and knees extended. The examiner is standing with the distal hand or forearm under the subject's heels and the proximal hand on the subject's distal thighs. With the subject completely relaxed, slowly raise the legs until pain or tightness is noted. Low back pain occurring at hip flexion angles less than 70 degrees is indicative of sacroiliac joint involvement. Low back pain occurring at hip flexion angles greater than 70 degrees is indicative of lumbar spine involvement. Spring test. The subject lies prone and the examiner stands with the thumb or hypothenar eminence over the spinous process of a lumbar vertebra. Apply a downward springing force through the spinous process of each vertebra to assess posterior-anterior motion. This action should be repeated for each transverse process to assess rotary motion. Positive finding is increases or decreases in motion at one vertebra compared to another are indicative of hypermobility or hypomobility, respectively.